Welcome to the "Oh no, my blood sugar is low" presentation, learning more about and understanding diabetes. This is part 1 of a 3-part course on diabetes. This training is provided by American Way University. My name is Angie Danielski, and I will be your guide during this training. Here's an introduction to the content of the full online presentation. Part 1 of the presentation, we will begin exploring what is diabetes. This will include the definition and the different types. Next, we'll look at the causes of diabetes, the role the liver plays in diabetes, symptoms, risk factors for type 1 and type 2 diabetes, and complications. Part 2 will begin by learning about diagnosing diabetes. Next, Part 2 will explore the medications that are used for diabetes, including an overview of the different types of insulin and a sample medication administration record. Next, Part 3 will begin with how to live with diabetes and what caregivers can do to help residents. Lastly, we'll look at sample orders for what to do when someone has hypoglycemia or low blood sugar. Part 1 of the presentation, again, will focus on the definition of diabetes, causes, liver function, symptoms, risk factors, and complications. I hope you enjoy. To begin, let's look at what is diabetes mellitus. Diabetes is a lifelong chronic illness where blood sugar levels are too high. There are 2 types of diabetes mellitus, type 1 and type 2. Type 1 is commonly referred to as juvenile diabetes, as most often people are diagnosed as children, teens, or young adults, usually prior to the age of 30. With type 1, the pancreas is not able to produce insulin at all, so daily injections of insulin are required. With type 2 diabetes, this is the more common type of diabetes that we see in the assisted living setting. This disease often occurs in adulthood. However, with rising obesity rates among teens and younger adults, type 2 diabetes is also on the rise for these younger populations. Type 2 diabetes occurs when we consume large amounts of sugar and our body cannot keep up with the production of insulin, or the cells don't respond normally to the insulin we produce. There is also gestational diabetes, but we will not be talking about this during this presentation. Diabetes is caused by too little insulin, resistance to insulin, or both. Insulin is a hormone produced in the pancreas that helps the cells utilize the sugar that we eat for energy. More than 20 million Americans are affected by diabetes. Diabetes has many possible causes. Type 1 diabetes is an autoimmune disease where the body's immune system attacks insulin-producing cells, or beta cells, in the pancreas. In essence, the pancreas no longer has any cells left to produce insulin. Genetic factors, or hereditary inheritance, has also been identified as a factor in type 1 diabetes. If a family member has type 1 diabetes, there is a good chance that the person's child or grandchild will also develop type 1 diabetes. Environmental factors, such as viruses and toxins, have also been linked to the development of type 1 diabetes. Research has shown that infant feeding practices are a contributing factor for the development of type 1 diabetes. Infants who are breastfed have a lower risk of developing type 1 diabetes than infants who were bottle-fed and were early cereal eaters. Type 2 diabetes is largely caused by obesity and physical inactivity. Poor diet and increasing consumption of various sugars or sugar-containing foods is a leading cause of type 2 diabetes. A diet high in sugar leads to weight gain and thereby the body not being able to produce enough insulin to keep up. The cells are not able to use the sugar a person is consuming, and the sugar stays in the blood. Exercise helps the body's muscles to use the sugar that we eat. When a person is mostly inactive, the muscles develop a resistance to insulin. This causes problems helping the sugar get into the cells to use as energy. Genetics have also been linked to the development of type 2 diabetes. The liver stores excess sugar that is not utilized by the cells. If the liver does not work properly, sugar may not be stored appropriately in the liver, or glucose may be released back into the blood, thereby raising blood sugar levels. The liver plays a vital role in blood sugar control. The liver helps to regulate blood sugar with the help of hormones released from the pancreas. When the blood sugar is too low, the pancreas will produce glucagon, which causes the liver to release glucose into the blood. If blood sugar is too high, the pancreas will release insulin to help the sugar get into cells, thus lowering the blood sugar. Excess blood sugar will be stored in the liver. Symptoms of hyperglycemia, or high blood sugar levels, include the following: excess thirst, excess hunger that cannot be satisfied, frequent urination, fatigue, blurred vision, and weight loss. Type 1 symptoms have a quick onset, whereas type 2 symptoms develop slowly, and some people may not feel any symptoms at all. Risk factors for type 2 diabetes include age 45 or older, being overweight or obese, physical inactivity, having a parent or sibling with type 2 diabetes, those of African American, Hispanic, or Latino, or Native American ethnicity, high blood pressure, high cholesterol levels, and a history of cardiovascular disease. Individuals with heart disease often have several factors placing them at a greater risk for type 2 diabetes, such as high blood pressure or cholesterol and being overweight and physically inactive. Those who have diabetes, regardless of if it is type 1 or type 2 diabetes, are at an increased risk for developing complications. Complications may include eye problems, such as diabetic retinopathy, where blood vessels in the back of the eye leak and cause spots of lost vision, as seen here in this picture. Blurred vision or blindness may also occur. Diabetics are at an increased risk for foot problems, such as sores, ulcers, or amputation that occur due to the damage of the blood vessels, which usually start at the feet and move up the leg. This can cause a breakdown in the tissues and an increased time that it takes for a wound to heal. Nerve problems, like diabetic neuropathy, can cause pain, muscle weakness, and problems with speech or swallowing. Tingling and numbness are very common for a diabetic to experience, especially in the feet. Digestion problems, such as gastroparesis or slow digestion, and constipation are likely to occur. Gastroparesis, or slow stomach emptying time, can lead to a person not absorbing nutrients properly, vomiting due to slowed stomach emptying time, and acid reflux or heartburn. Doctors emphasize the importance of having good blood sugar control along with a healthy diet and exercise to help minimize these complications. Those who have tight glucose control can prolong the time before these complications may develop. Not all diabetics will develop these complications. However, a fair number will probably develop some complications at some point in their life. This concludes Part 1 of the American Way University training of, "Oh no, my blood sugar is low," learning more about and understanding diabetes. Thank you for your participation. If you have any questions or problems with the presentation, you may email me or you may feel free to call our office. For further training opportunities, please visit our website.